Well, thank you and good afternoon. We've been on a journey together, a journey that will take a world-class academic medical center to new heights. And today we're going to sharpen our focus around the great work that we've done together as a community. This really outlines the journey that we've been on, which really began in 2015 as we really reconfigured the organization for success. Positioning it and then working together with the board, making significant changes in specific committees such as the Safety and Quality Committee, and working together with the board to change the framework of the board meetings themselves, getting deeper and more substantive conversations about many things. We engaged a community that came together around defining purpose, revisiting our values, thinking about the principles that we will use together to operate the organization. And then this year we began a strategic planning process that we have really done together. It's been a dynamic, iterative process. The board has approved the strategic directions that we're moving in. We will be refining that process together as a community. And this fall, we'll be at the end of that strategic planning process with a brand new plan in place that will take us to an incredible future. I also want to acknowledge on behalf of the entire UHN community our sincere thanks to the trustees who are leaving the board now. As Brian said, their collective effort represents more than 40 years of volunteer service to our organization. And we have benefited enormously as a community, as an organization. And it can be honestly stated that patients around the world have benefited from your contributions. Eileen's contributions in higher education, in governance, in healthcare, in finance have been profound. I've learned a tremendous amount from her during my time here. Bob Krimble, your family, the commitment that you've made to this community has just been extraordinary. I consider you to be such a great friend, a colleague, and your contributions and those of your family to UHN have simply been extraordinary. And of course, John, what can we say? In terms of the bond that you and I have had, Sunday mornings at your place by the fire, as we really work through some of the challenging things that we face together. So I want to really extend a round of applause for these trustees who've done extraordinary effort. We'd also like to extend a welcome on behalf of the UHN community to our incoming trustees. If we look at Kelvin Dushnitsky and the contributions that you will make. I got an email earlier today from Peter Monk, and his short words to me were, "You couldn't have found a better guy for the job." And we're so thrilled to have you on the board. The insights that you will bring in terms of operations and safety coming from a global mining company will really help us in our safety transformation. Peter Menkes, we extend our welcome to you also. We've got a diverse portfolio of real estate assets, and we're looking forward to your insights as we think about how to work that portfolio to our benefit and to the benefit of the community that we serve. And Dr. Ross Baker, who couldn't be here today, what we could say about Ross is that if you were to ask any international member of the patient safety community, who is Canada's leading authority in quality and safety, everyone would answer Dr. Ross Baker. We couldn't ask for a better trustee to be here to help us to shepherd caring safely forward together. So we want to extend another round of applause for the incoming trustees. John, just a few comments about yourself. It's really impossible to put everything on a single slide, but as we think about your contributions to UHN, we think about the great work that took place in nearly a decade as board chair, the impact in creating the notional concept of a research hospital, something that I hear coming out of the mouths of politicians and bureaucrats, something that's embedded in language that's in David Naylor's report to the federal government. That really is a direct result of work that came from you and the leadership team and the entire UHN community. We look at the successful integrations and the reality that we are viewed as an organization that has capacity and capability to integrate. And we look at the growth of innovation and commercialization through Mars, and we look at the recognition that you have received from Canadians through the Order of Canada. So we're really so grateful, John, for all of your contributions to UHN. Now we've got some new members joining the organization. Most recently, Larry Baldachin coming to help us as Chief Business Officer. Larry comes with significant experience in other sectors, including telecommunications. And as we look at his experience with Dell, with Rogers, and Canadian Tire, his experience in business development, his understanding of mergers and acquisitions, that business insight and expertise will be absolutely what we need in order to help drive us forward, to develop strategic relationships with industry partners in the future, and to help us to streamline our internal operations and financial approaches to business in the organization. We've also had, believe it or not, Brad in his role for 8 months now, as Brad really takes over from Chris Page, begins a process of really learning about the great discovery that's occurring throughout the organization. We work now to seek out a replacement director to oversee cancer research at the Princess Margaret Cancer Center, and Brad is really leading that search and working hard in the strategic planning process as we work to deeply integrate research into clinical care and education as we move our strategy forward. We've got congratulations to extend to internal leaders who've been promoted in the organization, recognizing their excellence. Catherine Wang, who moves from her unbelievable contributions in JDMI to take a leadership role as Vice President for Clinical Operations and Diagnostic Partnerships. We're just thrilled to see you moving ahead, Catherine. Jan Newton, who's demonstrated her expertise at Toronto General and Toronto Western, now moving as a site leader for us at the Western. Darlene, who moves into her role as Chief Financial Officer and Vice President. We're so proud of you, Darlene. When we see your contributions in terms of your financial insight, your communication skills, we're just thrilled to have you here and moving forward into this role. And of course, Emily Musing, and the unbelievable work that she oversees for us as we move safety forward for all of us and for all of our patients. So I'd like to extend another round of applause for all these individuals. Couldn't ask for a better team. This has been a year of headlines, and what we've extracted here are some of the words that have appeared through the great communications that have come forth from multiple channels, from inside the organization, from the great work that comes forward, supported by our tremendous foundations, supported by specific individuals who help to shepherd our donors. People like Todd Halpern, who's here today, people who are here who've given tremendous amounts to the organization through their time, their energy, and their effort. And this is the product of that as it gets recognized around the world in headlines, in communications that come from UHN, as we are really achieving global impact. I want to highlight some of the accomplishments that we've made in the defined areas of focus that we set out 18 months ago. We've done an incredible amount of work to refine our understanding of why we are here as an organization and to revisit our values. We've implemented an unbelievable program to focus on the safety of ourselves and patients. Now we see huddles being conducted throughout the organization at all levels in every single one of our hospitals. We've engaged patients in so many activities around the organization, in committees, in our strategic planning process, in the beta testing of our portal, in our thought process behind material changes that we make in how we approach patients in the organization, involving them in over 100 different activities as an expression of our understanding of why we're here as an organization to serve them. We've worked on enhancing the culture of engagement through communication channels of all different sorts, through town halls, through forums, through face-to-face conversations. We've built an Office of Stewardship and Sustainability that allows us to really embrace stewardship as a core value and to really drive changes of operational excellence throughout the organization. We've consolidated 22 gifted and talented IT teams into one entity, UHN Digital, that is coming together to create an incredible future for us. We've worked hard, and the board saw the integration report from our Mitchell integration. Many people would say, and the board would agree, that we completed that ahead of schedule. That was no small feat, because that was a first in Canada integration of a health system with an educational institution. And we've done incredible work as we look at the initial gift coming from the McEwen family and how 15 years later that was translated into Discovery that was commercialized in 2016, bringing together a venture capital firm from the United States, a pharmaceutical company, Bayer from Germany, and creating a new company to be based right here in Toronto, Blue Rock Therapeutics. That is an example of what we can do together, and a transaction that's valued at $225 million. That is the type of work that we can do when we come together as one UHN. We really can't do this without all of you, without our people. And we really want to acknowledge and thank the unbelievable community that we have that comes together behind our mission. Our employees have recognized this and have placed us among the top 25 companies in Canada across all industries. And we sit on a list with organizations like Starbucks, Apple, and Deloitte, the only healthcare organization in Canada that appears on this list. That's an acknowledgement of what our people feel about working here at UHN. Some of the best work that we did last year was around our purpose, values, and principles. If you look at our purpose statement, and you think about it for a moment, transforming lives and communities through excellence in care, discovery, and learning. Just think about that for a minute. That is exactly what we do here every day. That is exactly what happens in every clinic, in every operating room, in every lab, and in every environment where we interact with learners. We created a value hierarchy where we came together and we demonstrated our commitment to patients with a primary value that their needs come first. We looked at our set of values. We embraced compassion, integrity, and teamwork. And we added to that safety with the understanding that we couldn't be a healthcare organization privileged with our ability to take care of other human beings, administering life-saving services to them. How can we do that without embracing safety as a core value? How can we engineer a transformation around safety without safety as a core value? We also integrated stewardship into our value system, understanding the need that we have as stewards of a publicly funded system, taking resources that in essence come from patients and using those resources responsibly, wisely, efficiently through a value framework that includes stewardship as a value. One important element to this is our personal commitment to these values. These are photographs that were taken during some of the town hall events that we had that involved thousands of our employees. And you can see through the process of putting our individual fingerprints on the tree or signing our own signatures that this indicates personal commitment to these values. I want to share with you a video that helps us to understand the impact of this on the UHN community. UHN is a national asset for Canada. We are leading Canadian medicine.
We never stop settling for the status quo. We always try to improve.
The sky's the limit.
It inspires me to want to perform good work each and every day. It's a place that you want to come to work at, and ultimately where we can attract people that share those values.
The purpose, values, and principles really allow us to focus on what we're here for.
Hey, Corey. Good. How you
It describes what it is that we do and why we're in the business that we're in.
It really helps me put into words what my staff do every day and what the expectations are.
It brings everyone together.
It helps us remind us why we come to work every day.
Living the purpose, values, and principles means coming to work every day and giving your all for the patients.
I think that PVP really, it speaks to every person at every level of the system.
UHN's primary value at the needs of patients come first.
They're the reason why we're here.
We pride ourselves on being a very caring organization.
And by doing very simple things like introducing yourself to a patient,
Taking time out of a busy day to sit with a patient, hold their hand,
making sure that somebody's able to find their way.
and listen to them share stories, past memories, experiences within healthcare, and their hopes for the future.
Taking that extra minute to really acknowledge that person will go a long way in improving their day.
I think it's important that they see, no matter where they go at UHN, that we all carry ourselves with the same purpose and the same value, and that their needs will come first no matter where they go.
Purpose, values, and principles really is the DNA that codes how we operate in the organization. It's a fundamental element of how we think about how we care for each other and the patients here at UHN.
The objective of the institution is to support the patient, but also support its staff.
We are hardworking, we are compassionate, supportive individuals.
Hey, Georgia. Hi, Paula. How are you?
We treat each other with respect, we treat each other with dignity.
It's really trying to be safe, to work safe, and also to respect one another.
I think it unites us.
It creates a bit of a family environment.
Living the purpose, values, and principles means coming together as one UHN.
Sometimes you leave at the end of the day wondering if you've done all that you could. And if I can look at that card and know that I did put the needs of the patients first, I don't have to be quite so hard on myself.
When everyone is living these values, it creates the kind of work environment where we can achieve our purpose.
To work at UHN means being the best you can be.
At UHN, we believe that anything is possible.
Working here has enabled me to do things that I never thought I would do in my career.
It makes me want to wake up in the morning, want to go to work, want to work with my colleagues, want to treat that patient.
It's amazing to come to work and work with really, really bright minds that are all working together for a common goal.
It makes me very proud to be part of this institution.
Simply incredible, isn't it? When you really think about the amazing stuff that we do together. I'd like to ask Dr. Joy Richards to come forward to bring purpose to life and to talk about a situation that happened recently that will really illustrate the commitment that we have to our values here at UHN. Joy, thank you.
Hi, everybody. So I want to tell you a story that's the story of all stories that brings our values to life in a way that I think you'll always remember. I want to take you back let's say a little over a month ago, May the 11th, tail end of nursing week, the eve of Florence Nightingale's birthday. This is important to remember as you hear the story. One of our patients and dear friends of UHN, who's a deep friend of nursing, is Ivan D'Souza. And Ivan, many of you will know, the D'Souza Institute is a nursing institute that supports oncology lifelong learning, and Ivan and his late wife are responsible for bringing that to life. So he's a dear friend of nursing. On May the 11th, beautiful day, if you recall, late in the afternoon, Ivan decided to take both of his dogs for a walk. Now, he decided to go to a dog park that he normally doesn't go to, and he had to get in the car to drive there. So he gets to the dog park with his 2 dogs and is out for a lovely stroll. And God forbid, he had a massive heart attack and dropped to the ground. Vital signs absent. There were other people in the park that day. There was a gentleman who saw Ivan hit the ground, face first, and he was talking to a nurse who was also walking her dogs in the dog park that she normally doesn't go to. She right away jumped to action, as nurses do, got all of the volunteers and all the people in the park organized. Someone called 911. She started chest compressions right away. And she managed to sort of keep the dogs at bay. You can imagine both of the dogs were highly panicked, trying to lick Ivan's face. She stabilized him. The paramedics came. After the paramedics took Ivan in the ambulance to a community hospital, she then coordinated the care of the dogs to 2 total strangers who didn't own dogs themselves. And she got them all organized, dog beds, food, the whole thing. I think the dogs actually had quite an exciting night. And Ivan ended up arresting in the ambulance one more time before he reached the community hospital, to which he then arrested again. In the meantime, his friend and the director of the D'Souza Institute, Mary Jane Esplin, who is also a registered nurse, was called and arrived to the community hospital in emergency and recognized immediately as a nurse that the care that Ivan was receiving really wasn't what he deserved. And she recognized that as she was having conversations with the caregivers there, that in fact they'd given up on him. And so, as nurses do, she advocated on behalf of Ivan and quickly got on the phone and called Dr. John Flores, who is Ivan's cardiologist. And Ivan worked with the team, so you can see how teamwork comes together across hospitals to make sure that Ivan received the stabilized care that he needs and had him moved immediately to Peter Monk Cardiac and to the cardiac cath lab, where he was stabilized, and Dr. Overgaard performed miracles on Ivan, and he moved to the CCU, where he was put on a ventilator and carried on. Now, the nurse who responded in the park happened to be a cardiac nurse, which was very lucky. She also happened to be a UHN cardiac nurse. So Sylvia arrived to work the next morning because she's in the cath lab covering a maternity placement. So she arrives in the morning, if I've got the story right, walks into the cath lab, and it's a mess. And she says, "What happened?" And she says to a colleague, what happened? And the colleague said, "Well, there was an emergency that came in yesterday afternoon, and we haven't had a chance to clean up the room." So she thought, "I wonder if it's the same man that I assisted in the park." Couldn't be. He went to a community hospital. But being curious, she went and looked at the medication card. She only knew his first name, didn't know who he was or his importance to us at UHN. And so she realized that the first name was Ivan, and she thought, how uncanny is that? There must be him. So she went into the CCU, of where she is a nurse, and Ivan's bed was right inside the doors. Now, Ivan was intubated, but he was totally alert. And so you can imagine the wonderful reunion when these two came together. So I'm really happy to say that our values came to life across formal and informal caregivers. The really wonderful thing is that Ivan and Sylvia are here with us today. So just a little over a month, and I'm telling you, he's in really great shape, thanks to the interprofessional team and all the hands that were laid on him. I do want to say 2 additional things. This past weekend, Ivan was able to go back to that dog park, and it just so happened, he got out of the car, and the gentleman who called 911 was in the park with his dogs, and he had an opportunity to say thank you and to actually recognize his informal team who really saved his life. As well, it's very exciting that the D'Souza Institute was started because of the experiences that his wife had during her battle with cancer, and recognizing the need to help support cancer nurses to develop more knowledge. And so I'm really thrilled that we are exploring what the art of the possible might be for cardiac nurses to be part of the D'Souza Institute. So it is a very sweet story, and if Hollywood gets a hold of this, Ivan, you're going to be famous. Anyway, it's just a wonderful story. I just want to take an opportunity again to recognize Sylvia. You saved his life.
Outstanding. Thank you so much. Well, Sylvia, we really thank you for your personal commitment to these values, and your actions both in the park and at work really demonstrate the type of commitment that all of our health professionals have, the unbelievable staff that we have. Ivan, I think it's fair to say that you wouldn't be here if it weren't for Sylvia. You wouldn't be here if it wasn't for a Peter Monk Cardiac Center. You wouldn't be here if it wasn't for a UHN community coming together. And we wouldn't be here doing all this work if it wasn't for the donors that were behind us, creating the opportunities for us to create the discovery. So thank you very, very much. On the theme of the needs of patients, I'd like to talk a little bit about our patient portal. It's been an incredible demonstration of teamwork as our group, again led by Joy, Selena Brudnicki, and others, coming together with UHN Digital to create this patient portal. When we look at the metrics associated with this, 20,000 people have signed on to this portal at a rate of nearly 1,000 patients a week, really demonstrating tangibly to us the pent-up demand that exists in our community for patients to have access to their own medical records. When we look at the adoption rate, it's 5 times the national standard, again demonstrating without question that patients who get high-end medical care here have unique needs and want access, need access to their own health records. The fact that 4 out of 5 patients go back to the portal regularly is clear demonstration that the tool that we've built, with input from our clinicians, with input from our patients, and with creativity from our human factors group, is really valuable for patients as they use it on a consistent basis to help them gain insight into their care. This quote comes from one of our clinicians who said, "If it's important enough to patients, it's important enough to discuss." And that's the approach that we want to take as we become increasingly more patient-centered as an organization. The work of our teams have received international recognition not just here in North America, but also in Europe and in Asia, from the great work and from this incredible contribution that really represents amazing teamwork and tremendous benefit for patients. They've also already won 2 awards as we look at the Canada Health InfoWay Award and the recognition from the Vision to Reality Innovator Awards earlier this year. Again, a demonstration of the incredible work and our commitment to patients and their needs. As we look at the impact of this, here's one of our patients, Sherry, who's received services at the Toronto General and the Toronto Western. She's moving to a new community, and through the functionality that's present in our patient portal, she can assign access to her medical records to her new physician. And that individual can have deep insight into her care here and can coordinate care as she moves to a new community. And you can see her quote as she talks about the impact that this has had for her. "I have been so impressed with my UHN. I can see all my upcoming appointments in one place, and my file notes are posted so quickly. It gives me great peace of mind." That's exactly why we exist. That's exactly the type of focus that we want to bring to the patient experience here at UHN. Our focus over 8 months, with thousands of us coming together through focus groups, through a 48-hour electronic jam session as we came together to jam together on social media channels about our values. This helps us to bring about values-based leadership principles that are baked in and hardwired into the organization. It's the bedrock upon which we will build our strategic plan, and it will help us as we really make complicated decisions to allocate resources, manage performance, and to unify behaviors in accordance with our value system. Now, a few words about strategic planning. We've gone through a process throughout this year engaging the organization in numerous ways. Our senior management team has been deeply involved in 11 sessions dedicated to discussion, debate, and iterative refinement of an unbelievable plan that we're shaping now. We've had a whole series of engagement processes internally with 40 separate presentations in different sites, in different forums, with different groups throughout the organization. Engagement of our board in 3 successive meetings designed to create progressive engagement, understanding, insight, feedback, perspective, refinement as we move the plan forward. Conversations with government as we look closely at how we can align that plan with government plans. Conversations with industry partners from biotech, from pharma, and from other companies that we can partner with in the future. And of course, conversations with our donors who are energized by the plan that we're formulating and who we want to look to for guidance in terms of how we can refine the plan in order to supercharge it with private capital moving forward. As we've worked together with donors, we've integrated with our foundations and have had all 3 foundations involved in the planning process in different ways. And we've put all the materials on a dedicated SharePoint site and visible transparently on a website that we've created, which is accessible both internally and outside the organization to gain insight into what we're doing, how we're doing it, who's responsible, and where are we going as an organization. This outlines the 5-phase process, and you can see we've been moving progressively to the right. As we sit today now with 3 separate forums for board engagement, we're moving towards a summer of work group planning and moving towards a process where in September we'll have the board come together to review the final plan. And then we'll begin a process of working against that plan, publishing the plan, and then working throughout the organization to integrate that plan over a period of 18 to 24 months through all the business units, all the clinical areas, all the research institutes in the organization. I've said before that we are famous for what we have done, but it's very important for us to remember that we need to be famous for what we will do as an organization. And that really emphasizes the importance of this strategic plan. We can't rest on our laurels. We have to recognize our responsibilities as a national asset for Canada, and we have to position ourselves in ways that allow us to maintain our position of world leaders. We've done our framing through big dots to establish goals that are set around 2030. That may seem far in the future, but we need to establish goals that are far enough in the future that we can align ourselves to accomplish big things together, quantum leaps, major transformations. If we look at the strategic areas that we've defined, they're outlined here. First, our move to population health, as we align ourselves with the strategic aims of almost every OECD country, as we position ourselves to execute together with the LIN and the ministry on a process that converts us from episode of care-based providers to longitudinal managers of health for a population. As we think about our digital future, not just the work that we're doing today to unify, to consolidate, to make wise decisions, to create one UHN Digital, but the work that we will do tomorrow to bring a new clinical information system, to position ourselves to be the architects of how artificial intelligence will be used in healthcare. That will be a huge part of our digital transformation. That work will enable other parts of our strategic plan. And then we will come together as an organization We will think carefully over a period of time to how we can accelerate our mission impact. We will do so to focus on major conditions that impact Canadians, their health, and our economic burden that we have as a society. This will allow us to think carefully about how we evolve excellence and how we really integrate in a deep way all the work that we do in research and education. As we do this planning framework, we do so thinking into the future, thinking about a timeline that's set in 2030, thinking about how society will look at that moment in time, thinking about where science will be, thinking about how medicine will change during that period of time, and making certain that we are driving that transformation. As we do that, we want to set goals for ourselves that are aspirational. We exist as an organization to do great things. We have an obligation to Canadians to set quantum leap goals for the future and to solve difficult problems like curing cancer or stopping cardiovascular disease or halting Alzheimer's disease or preventing those diseases from occurring in the first place. We want those goals to be designed in ways in which they're mutually reinforcing and where our teams can come together and where we can leverage all the strengths that are present in the organization to do great things in the future. I'd also like to make some very important comments about the foundational elements that we're building into our strategic plan. 18 months ago, we identified these areas of focus for the organization as part of our process to refine our focus and to really plan for the strategic planning process that was to come. Much of the great work that we set out to do 18 months ago is completed. For example, the Michener integration. And this allows us to take these areas now and to consolidate them and to create them as foundational elements that will be present forever, that will be embedded as work, that will be put down into every organizational unit. We want everyone in our organization, at every unit in the organization, to understand and embrace our commitment to caring safely. We want everyone to understand the focus that we will bring to operational excellence, the work that will come from our OSS, from dedicated operational teams that will work together to create efficiencies that we have not yet seen, to work on bed flow management, to work on integrating with the community, and to bring us to heightened degrees of operational excellence. We will continue to invest in people, in training, in leadership development, because our biggest assets are our people and our culture. These areas will be integrated into the strategic plan and will be key areas that we will build out as we develop the plan together. So if we're thinking about the plan and how it will be framed for the future, this could be viewed as a graphic table of contents for our strategic plan. The 4 foundational elements that we will build out with clarity and fidelity and that we will drive into every unit in the organization. And then the strategic areas that will help us to set ambitious goals for the future. All of this will involve creating the triple helix and deeply integrating research and education into the clinical enterprise, into ways in which we cannot even imagine today, but ways in which our teams will create as we evolve the plan together in the first year of execution, especially around the 3rd big dot, where we want to understand how to optimize that and how in the future we can develop strategic industry relationships. Our plan will lead us to patient-empowered care, as illustrated by the portal work that we've done already and by additional work that we will do together to create much more empowered patients in the future. We will see even more fully integrated teams, more deeply engaged, and a heightened focus on operational excellence. We will be working together through caring safely to get to 0 never events. We will always be chasing 0 as an organization. We'll be working to build world-leading science. That is what people are expecting of us. That discovery, that curiosity-based science will lead to cures for patients who have diseases that we're treating today in our clinics. We will create a learning health system where we learn not only from patients who are in randomized clinical trials, but we create an environment where we practice evidence-based medicine and evidence-generating medicine, where we learn from every single patient. And we create data systems that are around us that allow that type of learning from every single patient. That will be through the great work that we do together in Big Dot 2 that creates that digitally enabled future and allows us to come together, fusing those elements of the Big Dots and allowing us to execute on strategy. And we will be leaders and be recognized as leaders for population health provision as we convert the organization from where we sit today, episode of care-based providers, to longitudinal managers of health and wellness. So together, we will come to deliver on our purpose, to continue to transform lives and communities through the excellence in care, discovery, and learning. Thank you.